Good day, Mrs. Annie. And you must be her husband, Mr. Joe.
Yes, I am Mrs. Annie's husband.
It's nice to have both of you here. Mrs. Annie, you seem a bit nervous. Is everything all right?
Not really. I'm just a bit worried about this. I've had a bad experience at the dentist before, and it's hard to shake off.
I completely understand. But please don't worry. I won't do anything to hurt you. You can trust me 100%.
It's all right, honey. I'm here with you throughout the process. You'll be fine.
Okay. I trust you, Doctor.
Excellent. Now let's get started. All right, Mrs. Annie. I've already reviewed your medical history, so we can skip that part. Now, I'll just take a look at your mouth visually to see what we're working with. Is that okay with you?
Yes, that's fine.
Perfect. Let's begin. I see. There are areas of redness and swelling around your gum line, along with some tartar buildup.
Is that serious? What could be happening?
Based on what I've observed, it appears you may have developed periodontal disease or gum disease.
Oh no. Really?
But before we conclude on that diagnosis, I'll need to conduct an X-ray and gum assessment to get a clearer picture of your oral health. Please lean back and relax on the chair. Bite down on this plastic device to stabilize your head. As suspected, it does appear to be gum disease. I can see signs of horizontal and vertical bone loss and the presence of tartar or calculus below the gums on your X-ray. The measurements taken during the gum assessment show you have readings of 5 to 6 millimeter pockets, also indicating you have gum disease.
Is gum disease serious? And what are the consequences?
Gum disease is indeed serious. It's a chronic inflammatory condition that affects the gums and supporting structures of your teeth. If left untreated, it can have dangerous implications beyond your oral health, affecting major organs in your body.
Major organs? It could be that severe?
Yes, unfortunately. Many people often underestimate the harmful effects of periodontal disease, thinking it only affects the mouth. However, 7 major organs in the body can be affected by it. Would you like to learn about them?
Of course. I absolutely want to know how that's even possible in the first place and understand how gum disease can affect other organs in the human body.
I'm curious too. Let's hear about it.
Did you know that beyond just affecting oral health, periodontal disease can actually have a major impact on your heart?
How does it affect the heart, doctor?
Well, when your gums are infected, bacteria from your mouth can actually enter your bloodstream. And once they're in there, they can cause inflammation throughout your entire body.
That sounds bad.
It definitely is. What's even more concerning is that these bacteria can latch onto the fatty plaques in your heart's blood vessels. This leads to inflammation and narrowing of the arteries, a process known as atherosclerosis.
So does that mean gum disease can lead to heart problems?
Exactly. The inflammation and narrowing of the arteries can contribute to the progression of existing heart conditions. Also, this can increase the risk of cardiovascular issues like heart attacks and strokes.
OMG. Now I'm really scared.
You don't have to be, Annie. With the right treatment, you'll be on your way to recovery in no time.
I hope so.
It's important to know that gum disease isn't just a problem for your heart, it could also affect your brain.
My brain too?
Yes. Studies have shown that the bacteria from gum disease can travel to the brain through nerve channels or the bloodstream. Once there, they can trigger inflammation and potentially damage brain cells, increasing the risk of cognitive decline and development of Alzheimer's disease and other forms of dementia later in life.
Oh no, I don't want that. Having dementia will be unbearable for me.
I understand, Mrs. Annie. That's why maintaining good oral hygiene is so important.
True, Doc. And none of those complications will happen on my watch, honey. We'll make sure you're well taken care of.
How lovely. But we are not done yet. The lungs can also be prone to periodontal disease.
Really? How?
The lungs can be affected by gum disease in several ways. When the gums are infected, bacteria can be inhaled into the lungs, leading to respiratory issues. This can increase the risk of developing respiratory infections like pneumonia. Similarly, chronic inflammation in gum disease can worsen existing lung conditions like asthma and chronic obstructive pulmonary disease, or COPD, and may also weaken the immune system, making you prone to lung infections.
I've always thought smoking is the main cause of lung issues. I had no idea that having gum disease could also lead to lung problems.
I'm equally surprised. It's mind-blowing how connected our body systems are.
When it comes to human health, there are many things most people aren't aware of. Let's talk about the kidneys. Ever thought gum disease could affect them?
Not at all, Dr. Mary.
Well, it's generally known that the kidney is responsible for filtering out waste products and excess fluids from the blood to form urine. Now, since your kidneys are acting as filters, imagine if those filters get clogged up. That's what gum disease can do. When your gums are infected, they release harmful bacteria and inflammation into your bloodstream, which can travel to your kidneys. This extra workload strains your kidneys, making it harder for them to function properly, potentially leading to kidney issues down the line.
This means the bacteria and inflammation from gum disease could affect the kidney's ability to function properly?
That's the point. By taking care of your gums, you're indirectly protecting your kidneys too.
Duly noted. Thanks for the insight.
Anytime. I noticed from your medical history that you're managing type 2 diabetes, correct?
Yes, that's right.
I'm sorry to hear about that. But I wanted to bring up something important related to your health. Are you aware that there's a connection between periodontal disease and diabetes?
Really? How is that even possible?
It's quite fascinating. Gum disease can affect the pancreas, the organ responsible for producing insulin, which is a hormone that helps to regulate blood sugar levels in the body. Research suggests that the inflammation from gum disease can make it harder for your body to regulate blood sugar levels, which is particularly concerning for people with diabetes.
That's concerning.
It is, but here's the good news. Treating periodontal disease can potentially lead to improvements in managing diabetes, and studies have shown that addressing gum disease can positively impact glycemic control in diabetic patients.
That's encouraging. I'll definitely prioritize treating my gum disease then.
Good to hear. Moving on, periodontal disease can also affect liver health through the spread of bacteria and inflammatory molecules from the infected gums. And since your liver is responsible for detoxifying your body and aiding in metabolism, it can become overwhelmed by these inflammatory substances.
How does it affect the body long term?
Chronic inflammation from gum disease can disrupt the liver's normal function over time. Plus, it can increase your risk of developing liver conditions like fatty liver disease.
Honey, I think you should get your teeth checked too. And we should definitely bring our grandkids in for dental checkups. This is really concerning.
Yeah, you're right. I'll schedule an appointment soon. It's just so surprising to think about how something as simple as gum disease can have such effects on our health. We really shouldn't take our oral health for granted.
Exactly. Our oral health is often a reflection of our overall well-being. That's why it's super important to keep up with regular medical checkups. This brings us to our last major organ, which is the joints. If the gum is infected, it could also lead to some implications for the joints.
Joints? How?
Gum disease, especially when it leads to inflammation, can worsen conditions like rheumatoid arthritis or joint inflammation. The inflammation from the gums can spread to the joints, causing increased pain and stiffness.
That actually makes a lot of sense. I've been feeling some discomfort in my back and knees lately. Could my gum disease be connected to that?
It's possible. In fact, people with rheumatoid arthritis may have a higher risk of developing gum disease due to shared risk factors like genetic predisposition and immune system issues. That's why it's essential to not only treat gum disease, but also to maintain good oral hygiene to support joint health.
Thank you for explaining that, doctor. This has been really informative. I'm committed to getting my gum disease treated and improving my oral hygiene.
Count me in too, Annie.
That's a proactive step, both of you. Remember, Maintaining good oral hygiene and seeking treatment for gum disease are important steps in managing and supporting overall health. Mrs. Annie, you will need a deep cleaning below the gums to get the gum disease to go away. I'll refer both of you to my dental hygienist, Sylvia. She specializes in gum and teeth cleaning. She can better explain the process and give you dietary and oral hygiene tips. Thank you for watching. If you liked this video, please subscribe and watch more videos here next.